What if I told you that your hip pain isn't permanent, and you don't need expensive treatments, injections, or complicated routines to fix it? What if just 5 simple exercises, done consistently, could help you move freely again, without pain, without stiffness, and without fear? Today, you're about to discover exactly that. Stay with me, because by the end of this talk, you'll have a clear, powerful plan to start healing your hips for good. Hip pain is often misunderstood as a permanent condition, something you just have to live with. But that's far from the truth. Every time you feel stiffness, soreness, or discomfort in your hips, your body is sending a clear message. It needs movement, support, and attention. Ignoring these signals only worsens the problem, creating patterns that can limit mobility, reduce strength, and impact your overall quality of life. The first step toward real improvement is understanding that pain is not your enemy. Pain is information. It is your body's way of communicating imbalance, weakness, or tightness, and responding to it correctly is what drives recovery. The hips are a central part of your skeletal and muscular system. They bear weight, stabilize your posture, and enable nearly every movement in your daily life, from walking and running to bending, sitting, and standing. When these joints and surrounding muscles are weak, tight, or misaligned, the entire body compensates, creating tension, fatigue, and discomfort that often extends beyond the hips. Sitting for long hours, aging, lack of targeted exercise, and even small postural habits can contribute to hip dysfunction. Over time, the hip flexors tighten, glute muscles weaken, and the stabilizing muscles surrounding the hip joint lose their efficiency. This imbalance leads to a cycle of pain. Muscles overwork in some areas while underworking in others, creating stress that the body struggles to manage. The good news is that with deliberate, focused exercises, you can break this cycle. Each correct movement retrains your muscles, releases tension, and restores natural function. Unlike passive treatments, these exercises actively engage the muscles that are most important for stability, support, and alignment. Many people avoid movement because it initially causes discomfort, but this is exactly where progress begins. Gentle, controlled exercises teach your body how to move correctly and safely, strengthening weak areas without overloading sensitive joints. For instance, when you start incorporating hip flexor stretches, glute activation exercises, and stabilizing movements, you are not just stretching or strengthening in isolation. You are teaching your body to redistribute forces, improve circulation, and reduce inflammation in the joint. Every repetition is a conversation with your body, a reminder that it is capable of adaptation, repair, and growth. It is crucial to approach these exercises with mindfulness. Focus on proper form, control movements, and awareness of how your hips respond. Do not rush. The most effective results come from consistency, patience, and precision. Even a few minutes each day, if done correctly, can begin to unlock tight hips, reduce chronic discomfort, and rebuild muscle patterns that have been neglected for years. Remember that recovery is not about intensity or punishment. It's about creating a sustainable, repeatable routine that your body can rely on. Your mindset is just as important as your physical practice. Seeing hip pain as a call to action rather than a limitation shifts the entire approach to rehabilitation. With the right exercises, you are actively telling your body that it is safe to move, that the joint is supported, and that the muscles are ready to work together. Over time, this encourages better posture, improved mobility, and a significant reduction in discomfort. Every movement is a step toward reclaiming the freedom and confidence that hip pain may have taken from you. The strength of your hips and surrounding muscles is not just about appearance or athletic performance. It is a foundation of your mobility, stability, and overall health. Weak glutes and hip stabilizers are often the silent culprits behind chronic pain, reduced range of motion, and even injuries in other parts of the body. Every time you walk, stand, or climb stairs, your hips bear the brunt of your weight. And when the muscles that support them are underdeveloped, the joints themselves must compensate. This compensation leads to strain, misalignment, and discomfort that can ripple through your lower back, knees, and even shoulders. Strength is the most effective medicine because it addresses the root cause rather than just masking symptoms. Many people underestimate how critical these muscles are. The glutes, for example, are not just for lifting or aesthetics. They act as stabilizers, shock absorbers, and power generators. When the glutes are weak, other muscles, such as the hamstrings or lower back muscles, take over the workload, which can create imbalances and increase the risk of injury. Similarly, the small muscles surrounding the hips, like the hip abductors and external rotators, play an essential role in controlling movement patterns. When these stabilizers are neglected, the body loses coordination, alignment suffers, and pain becomes inevitable. Strengthening these areas changes everything. It allows the hips to move efficiently, absorb force safely, and support the weight of the body during everyday activities. Targeted exercises like glute bridges, clamshells, and leg raises activate these key muscles in a controlled and deliberate way. These movements not only build strength, but also retrain the nervous system, teaching your body how to move with precision and efficiency. This retraining is crucial because weak muscles often result in poor movement patterns that reinforce pain. The concept of strength as medicine also includes endurance and control. Strong muscles that fatigue quickly or lack coordination are almost as limiting as weak muscles. That is why many hip rehabilitation exercises emphasize control repetition and slow engagement. It is not about lifting heavier or pushing harder. It is about quality, precision, and connecting mind to muscle. Feeling each contraction, noticing where tension is present, and adjusting accordingly ensures that the right muscles are doing the work, reducing stress on the joints and creating a safer, more effective healing environment. Strengthening the hips has effects beyond just the local area. Improved hip strength enhances balance, posture, and functional movement in daily life. Walking becomes smoother, bending and lifting become easier, and the risk of falls or strains decreases significantly. This functional improvement is one of the most overlooked benefits of building hip strength. People often focus on pain relief alone, but strengthening these muscles provides a protective layer that prevents future injuries, allowing you to live without hesitation or limitation. Consistency is key. The hips respond best to repeated, deliberate practice. Consistency is the true driver of transformation when it comes to hip health. Many people make the mistake of believing that a single intensive session or sporadic effort can undo months or even years of tightness, weakness, and poor movement patterns. The reality is that the body adapts gradually, and lasting results are built on repeated, deliberate action. Every time you engage in exercises for the hips, you're sending signals to your muscles, tendons, and joints that movement is safe, controlled, and supported. This repeated stimulus strengthens the muscles, improves circulation, and encourages the nervous system to optimize movement patterns. Without consistency, even the most effective exercises lose their power because the body cannot retain the benefits of effort that is scattered or irregular. Consistency also rewires the way your body moves. Weak or underactive muscles create compensatory patterns, and over time these patterns become habits that reinforce stiffness and pain. Performing targeted exercises daily, or at least several times a week, teaches your muscles to fire correctly, stabilizes the joints, and promotes fluid, efficient movement. Walking, climbing stairs, lifting objects, and even standing for extended periods rely on the coordinated effort of multiple muscle groups. Without consistent training, the body falls back into old habits, leaving the hips vulnerable to strain and discomfort. Every repetition matters because it contributes to long-term adaptation. Controlled exercises like glute bridges, clamshells, and hip flexor stretches are not just physical movements. They are messages to the body that can perform these motions safely and without pain. The nervous system learns from repetition, gradually increasing the stability, strength, and range of motion of the hips. Even brief daily sessions, performed with focus and correct technique, can produce significant improvements over weeks and months. The joints are better supported, the muscles are more responsive, and the risk of injury decreases. Pain that once felt chronic begins to diminish because the body no longer relies on compromised movement patterns that create tension and discomfort. Unlike one-off exercises, a routine performed over time creates measurable changes in strength, flexibility, and mobility. Tiny incremental gains accumulate into substantial results. A muscle that was once weak and unresponsive becomes strong and reliable. A joint that was stiff and painful begins to move freely and smoothly. Each session should be intentional, focusing on form, control, and awareness. Rushing through exercises or skipping sessions disrupts the process, while deliberate, repeated effort strengthens a connection between mind and muscle. This connection is critical because the hips are complex joints, influenced by multiple muscle groups and neural pathways. By consistently practicing the right exercises, you are gradually reprogramming your body to move efficiently, reduce compensations, and prevent future discomfort. Consistency is the bridge between potential and results. It transforms short-term effort into long-term change. The hips, when given consistent support and targeted movement, regain their strength, flexibility, and stability. Every repetition, every session, every day matters because these actions compound, producing a body that moves with confidence, freedom, and power. The body has an extraordinary ability to heal and adapt when given the right conditions, yet many people underestimate this potential, believing that pain, stiffness, or weakness are permanent. Every day, your muscles, joints, and connective tissues are capable of responding to positive stimuli, and the hips are no exception. When you approach recovery with intention, understanding, and structured movement, you are tapping into the body's innate capacity to restore itself. Every exercise, stretch, or controlled motion is more than just a physical act. It is a signal to the nervous system, telling it that mobility, stability, and strength are achievable and sustainable. The process of healing is built on repetition, focus, and trust in the body's ability to adapt. Many people rely on external solutions, medications, injections, or passive treatments, without recognizing that lasting improvement comes from internal effort. The muscles surrounding the hips, including the glutes, hip flexors, and stabilizers, respond to consistent activation by becoming stronger, more coordinated, and more capable of supporting proper joint function. The connective tissues and ligaments gradually become more resilient, and the body relearns how to distribute weight and force efficiently. This internal transformation is what leads to real freedom of movement, reduction of discomfort, and the restoration of confidence in everyday activities. The key to unlocking the body's healing potential is understanding that each movement matters. Small, controlled exercises performed correctly trigger a cascade of benefits. Increased blood flow, enhanced nutrient delivery to tissues, reduced inflammation, and improved joint lubrication. Over time, these benefits accumulate, resulting in hips that are not only stronger but also more flexible and less prone to injury. Even minor improvements in alignment, muscle activation, or mobility can create significant changes in how the body feels and functions. Mindfulness and awareness are essential components of this process. The body responds best when exercises are performed with attention to form, control, and engagement of the appropriate muscles. Rushing through movements, performing them incorrectly, or skipping sessions interrupts the body's ability to adapt and slows progress. By focusing on the quality of each repetition, you are not only strengthening muscles, but also teaching your nervous system how to control movement efficiently. This retraining ensures that the hips operate optimally in everyday activities, reducing stress on the joints and minimizing compensatory patterns that often lead to pain elsewhere in the body. The body's capacity to heal is amplified by the combination of strength, mobility, and consistency. Strengthening weak muscles, stretching tight ones, and practicing proper movement patterns all work together to create a system that supports itself. This integrated approach allows the hips to function as intended, enabling smoother motion, better balance, and a reduction in discomfort over time. The results are cumulative, meaning that each session builds upon the last, creating momentum that leads to measurable, sustainable improvements. Confidence in your body grows alongside physical changes. As the hips regain strength and flexibility, movements that were once limited or painful become effortless and natural. The body communicates readiness and capability, reinforcing belief that it can heal, adapt, and thrive. This creates a positive feedback loop. The more the body moves efficiently and experiences relief, the more motivated you become to maintain consistency and push for continued improvement. So, starting today, make a decision. No more ignoring the pain. No more waiting for it to magically disappear. Take control. Commit to these 5 exercises. Stay consistent and trust the process. Your body is stronger than you think, and your ability to heal is greater than you've been told. Remember, freedom of movement is freedom of life. Fix your hips, and you don't just remove pain. You reclaim your strength, your confidence, and your future.